Thank you so much, Mr. Rikas, for being here.
Thanks for the opportunity.
My first question, the Homelessness Assistance Act that was signed by past President Reagan in the late 1980s really seemed to bring awareness to the issue of homelessness. Do you think that government today really sees the need for assistance and assisting families today?
I think we're making progress. For context, the legislation that you're referring to is the McKinney-Vento Homeless Assistance Act, which was passed in 1987. What's disheartening on many levels is, 23 years, 24 years later, we're still dealing with this issue, and the issue has not gone away. If anything, it has grown in proportion. So that's important in terms of context. I think as the years have gone on, we've begun to look more strategically at where we put resources, and I'm encouraged actually by the recent trends and the programs that have been introduced specifically by the Obama administration. The Homelessness Prevention and Rapid Rehousing Act specifically puts money into prevention. And, those of us that work in the safety net agencies, if we had our druthers and we had we had sufficient resources, we would certainly prefer to spend them on prevention. With respect to homelessness, the principal issue and also the principal predictor of individuals and families becoming homeless is extreme poverty. And one thing that is surprising to many that live in this community and visit this community is that Monroe County has consistently had one of the highest poverty rates for many years now running. And so if you can imagine homelessness as an iceberg, people who are homeless today, people who are seeking shelter, families who are doubled up, staying in motels. If you can imagine those folks as really the tip of the iceberg, but underneath that is a much larger number of people living in poverty. Living in poverty is a very, very fragile equilibrium. Families and individuals struggle on a regular basis to balance the needs for paying their rent and housing costs, their utility bills, paying for childcare, transportation, and putting food on the table. And if there's the slightest upset to that equilibrium, that individual or family can very quickly be driven into homelessness. Many examples. It may be a healthcare issue that arises for a head of household. It may be something as straightforward as the car breaking down and the inability for someone to get to work, a child becoming sick, and the head of household is in a job where there really are no benefits for that. And so there are so many things that can trigger an episode of homelessness. But again, the great predictor in my view is poverty, and we have a significant problem here in terms of the prevalence of poverty.
Well, and you were talking about President Obama, his Opening Doors campaign, hoping to assist about 6,000 families with housing and other needs like that. Do you think that really is that's realistic right now?
It's certainly a step in the right direction. I think we have to have a comprehensive policy package, I think, if we're really going to address the issue of homelessness and begin to see some real solutions. As previous speakers have mentioned, one major causal factor is the cost of housing. And when we look at housing affordability, there's a study that's done nationally every 2 years on housing affordability in all 50 states. And the housing wage, which is a term used to describe how much a household needs to be earning to afford a medium-priced housing unit in a particular area. For Indiana, in the last study that was done, it was $13.58 an hour. And again, as we know here in Bloomington, much of our work is in the service sector, and certainly wages do not.
I hate to cut you off, but we'll get right back to that in just a few moments.
Okay.
Stan, back to you.
Thanks, Shamika. We've talked a couple of times here, both here and with Shamika and Mr. Rikas, about the idea of resources. And it strikes me that that's an important discussion to have, because you've got a couple of different issues. First, you've got how many people have enough resources to withstand the car breaking down or something like that. And do you have these silos of resources where some people have more than they need and there are a whole bunch of people who don't have nearly anywhere near what they need? Let's take the second half first. Is there a way to more evenly distribute these resources that would make sense either from a governmental level or from a local service level? Dan, we'll start with you as the elected official on the board here. What, if anything, could be done, for instance, at the township level or the city level or the state level?
You have to be careful that you don't adopt a one-size-fits-all funding approach, that you develop this is a benefit level, this level will solve your issue. What I think is more key than having a funding source is having a network, a really viable network of providers who each is serving a niche of this population. If someone is experiencing homelessness because of a lack of education, then that's a specialized area to work that person out of it. If a person is experiencing homelessness because of a lack of transportation, that's a totally different solution. So are the resources there? Obviously no. One of my children, when they were 6 years old, said, "Dad, I know where people are poor." And I said, "Why?" And they said, "Well, they don't have any money." Going back to Mr. Ricas's comment, poverty is the driving issue, but once you fall off the wagon and into this void, there's many different avenues to try to work a person out. It's far more specialized casework than I think most people understand to solve the problem. We don't solve it, I don't believe. We try to stabilize it more than anything else.
It sounds like what we might need is an individualistic checklist to say, do you have this problem, this problem, this problem, and how many of these do you have, and therefore what is the right path to send you down? Is that something that might be helpful to try to take people on an individual basis rather than as a group of the homeless?
Well, we do that with something called the family matrix, where we look at all the different areas in their life. It's sort of like a psychosocial evaluation to see what needs they have. And then you need to pull together all those resources. Maybe financial, maybe mental health, maybe substance abuse, parenting, those types of things, and work as a team within the community. You know, we take steps in the right direction, but we're not really there yet. We do a good job, but we could do a better job with that.
I wanted to get to a piece of tape we've got. We talked to a woman named Robin Porter, who's lived in transitional housing with her 2 young daughters for almost a year. We talked to her about her situation, and she was trying to qualify for assistance, but that was dependent on being enrolled in schools. So she started classes at Ivy Tech, and she was then put on a 6-month waiting list for benefits and had to find $160 a week to pay for childcare, and here's what she had to say.
Dealing with an ailing mother that's going through the process of dying and raising 2 children and trying to do school, and then you have this unbelievable issue that you have to deal with where you have to have funding every week, and just trying to figure out where you're going to come up with the money for 6 months, and then to do your withdrawal and receive a letter 2 weeks later saying, okay, you have your appointment now and we're going to give you some assistance. After a 6-month waiting period, you pretty much just get to the point where you give up. You know, I've got to stop something, and between the children and my mother and the schooling, the schooling had to be postponed. So yeah, that's something I think they really need to work on, as far as a 6-month waiting list for a mother that's trying to work or go to school if she doesn't have family to help her out is definitely an issue.
Again, joined in the studio with Mr. Joel Ricas, and such a very touching story by Robin Porter. In talking about the housing issue, we were just talking about that before we had to go to the last segment. HUD just announced last month that they awarded $14 million to the state of Indiana to assist 110 local agencies. To someone who says, you know, HUD assists, we have, you know, people who pay taxes, we have, you know, Medicaid, Medicare. There should be no reason why anybody is homeless. What would you say to that?
Well, again, I think the numbers are far beyond what people can imagine in terms of those who may need assistance both now and in the future. So, you know, we need to continue to make a commitment of resources across the board. Not only in housing, but the necessary social services, educational services, job training, a whole variety of issues, mental health and addiction services. All of those have to be part of it, you know, if we're going to successfully intervene in this issue.
Thank you so much, Mr. Ricas, for joining us this evening.
Thank you.
Stan, back to you.